Bore da pawb! Good morning, everybody, and welcome to HPMA UK Virtual Conference and Exhibition 2020. My name is Julie Rogers, and I'm delighted to be your chair today for the first of what promises to be a fabulous couple of days. The theme of the conference this year is Architects of Change, Transforming the World of Work, and HPMA colleagues have put together a superb programme to help us reflect, recognise and celebrate the key role of HR and workforce professionals in designing, developing and delivering the future vision for the healthcare workforce. Over the next 2 days, we'll be joined by speakers from across the UK, such as the HPMA 2020 winner of the President's Award for Outstanding Lifetime Achievement, Shirley Rogers, Parina Ishzar and Tom Simons from NHS England and Improvement, Will Young from the HSC Leadership in Northern Ireland, and of course my very own Helen Thomas from Health Education and Improvement Wales. I want to say thank you to all our exhibitors and stream sponsors who provide much needed support to HPMA, including for conferences like today. We are really and genuinely grateful for all that you do. You'll see from the programme that there is plenty of time built in for delegates to visit our new virtual booths and chat to colleagues, and that's something that I haven't done yet in a virtual conference, so I'm looking forward to doing that myself over the next couple of days. Those virtual booths provide an opportunity to chat to colleagues as well as to watch videos, and please take the time to do this and immerse yourselves in the whole experience of this event. As an added incentive, many of our partners are running competitions or prize draws in the booths too, and winners will be announced after the conference has ended, so a big incentive there to sort of meet some new people and join in. I understand from our organisers that we've had a fantastic response to this year's conference, with 600 plus delegates registered from Wales, Scotland, England and Northern Ireland. This for me illustrates the reach of the HPMA across the UK, the strength of our community, and also the relevance of the agenda. I know that these are difficult and exceptionally busy times, and so the fact that our speakers have taken time out to be part of these 2 days is even more appreciated. I hope very much that all the delegates will stay with us throughout the event and attend all of the sessions in full and be participative. Please turn off those mobiles and ignore those emails. Give yourself up to HPMA for the next 2 days. If you've got any questions for our speakers, type them in the chat bar and I will do my best to raise them on your behalf or the key themes where we get lots of questions, time permitting. You'll see from the programme that we've got some breaks for you to top up on caffeine, network and visit the virtual booths. I've got my HPMA Wales branch mug, which arrived in the post last week after our regional conference recently, which I'll be using to fill up with coffee in the breaks. And of course, this afternoon, we've got 4 really excellent stream sessions, which will run concurrently from 12:45 p.m. I've also been asked to remind you of the hashtags for the event. So at HPMA_national, hashtag HPMA 2020. And we'd like to see lots of Twitter activity, please. This is always one of those events that engenders a huge amount of interest. So please, just because it's virtual, let's not forget the need to tweet and share with colleagues who perhaps couldn't join the calls. So having got some of the formalities and a little bit of an outline of the next couple of days out of the way, before I introduce our HPMA President, Dean Royles, to give the welcome address, I just wanted to say a couple of words about 2020. This has been an incredible year, hasn't it? I don't think anybody would have predicted in March even that we would be in the situation we're in now back in December. It's been incredibly challenging and incredibly awful in equal measure. It's also been incredibly inspiring and incredibly heartbreaking. But importantly, it's been an incredibly transformative year. I have seen all aspects of our community in Wales step up on a level and a scale I've never seen before in 35 years in the public sector. Things that we have been trying to push over the line for many years have just happened overnight with a strong collective will and a unifying common enemy. So as we think about what being an architect of change means for each of us and the roles we play, let's pause for a moment to celebrate what we have achieved in the face of this dreadful pandemic. Let's think about how we and our colleagues have already helped to transform the world of work, how we have adopted new communication and engagement approaches, how we have successfully delivered digital and socially distanced training and education, and how we have stepped forward and led from the front as a community, whether that be through the creation of field hospitals, through the mass deployment of students and trainees, the upskilling of critical care staff, or moving final registration exams online. I have seen collaboration across the 4 nations of the UK in relation to workforce, OD and education flourish as we have worked together to respond to this awful pandemic. The joint innovation and partnerships forged will stand us in good stead as we face the second wave and prepare for the mass vaccination of our population on a scale we have never seen before, and also for the years of recovery and reset that lay ahead. Whilst we pay attention to ensuring that the innovation seeds we have planted are enabled to continue to grow, we also need to remember that we're in this for the long haul and think about how we look after ourselves, each other and our colleagues. I'm really pleased that we've been able to share the work in Wales on workforce wellbeing and resilience with other parts of the UK and also learn from practice in other nations. I'm looking forward to hearing what Shirley will have to say about culture and wellbeing in her session tomorrow. We've also gained so much as a nation from being part of the 5 Nations leadership community of practice. I'm unashamedly a disciple of compassionate and collective leadership and of the opportunities this approach offers to transform the world of work and staff experience of work. And I know that Will Young will tell you a bit more about why compassionate leadership is so important in our system now more than ever in his session after lunch. So in conclusion, my reflection would be that our profession is perfectly positioned to be the architect of change. We have shown we can be innovative and transformative, and we have shown most of all that we are up for it, more than up for it. Thank you HPMA for providing the platform for us to share our innovations and learning, or for giving us the space to reflect and reboot. So without further ado, I would now like to introduce a man who needs no real introduction, having been a stalwart or a pillar of our HPMA community for probably quite a few years, I would suspect. So it's my real pleasure to hand over to Dean Royles, HPMA President, UK's most influential HR practitioner for 3 years running, author and activist, to give you the welcome address. Thank you, Dean.
Thank you. Unprecedented, extraordinary, unique, unusual, complex and complicated. These are all words that have been used and overused this last year, and it was inevitable that I'd be using them to open a conference of leaders in the people profession who are at the forefront of managing and taming a pandemic. I can't begin to express how proud I am to be president of the HPMA at this time. It's been a year of learning for all of us, and a year in which I know you have called on your personal and emotional reserves to serve your organisations and the patients and service users that rely on them. Thank you. Hello, my name's Dean Royles, and thank you for joining our virtual conference. The HPMA and our sponsors really appreciate your support, and we believe we've got a fantastic event to encourage, to support and to develop you. Can I encourage you all to visit the exhibitor booths and to engage with the presentations and competitions? There's lots of goodies to be had, like John Lewis vouchers, Fortnum & Mason hampers, free virtual recruitment events, free training courses, and the list goes on. Now, as you appreciate, these virtual events aren't easy to organise. So on your behalf, can I thank the exhibitors for their support, and in particular, Serenity, excuse me, and in particular, Serenity, our event partner, and Liaison and Locum's Nest as our stream sponsors. Thank you to all. Now, last year I spoke to you from Manchester and in person, and that seems an age ago, a lifetime ago. And from here, you certainly all look much older. At that conference, I was looking forward with optimism and was predicting that this would be the year that HR would come of age. At last year's conference, I also laid out 3 myths that needed to be confronted about HR. The first myth was to call out workforce planning that was effectively based on what could be afforded in any one year rather than what would be needed in the medium and the long term. How much better prepared for the pandemic would we have been with the resources that were required if we'd been listened to years ago when we said we can't keep on operating at this level of intensity, relying on a workforce that has no capacity to flex and expand? The signs were there, and we called them out each winter. The second myth was the belief that everything, and I mean everything, that HR did could only be justified if we could show a return on investment, an ROI, when everyone knows that everything that counts can't always be counted. And the third myth was that HR professionals are procedure and process junkies, when I know that that's patently not the case. The vast majority of HR professionals I know are caring, compassionate, and indeed passionate about the services their organisations provide. They know that the NHS is first and foremost a people business. As professionals, I know that you're more concerned about organisational development and the development and growth of individuals than by any policy or procedure. However, we also know that regulators like the CQC put a premium on policies and procedures when assessing and judging organisations, and of course organisations respond to that accordingly. The over-reliance by regulators on governance and on what papers have been to the board meetings, and on your current policies and procedures, where you're more likely to face criticism for a policy that is 2 months out of date than for a poor judgment call. Of course, that leads organisations to emphasise and prioritise these things. This, combined with a fixation on benchmarking, where support functions are seen as back office and the cheapest is portrayed as the best, this has to change. Have you had a look at the model hospital website? Basically, the cheaper you are, the greener on the metrics you are. There's no attempt to assess outputs and outcomes and what you've achieved. This can't be right, and it's no wonder that people highlight policies and procedures when that's what we have to benchmark against. We need a change in approach from regulators. And if I may say, if we want boards to take HR as seriously as they take finance, then we need to ensure that HR leaders, like you, largely female, are rewarded like finance leaders, largely male. And if we get this approach right, we can all keep that human in human resources. And I know that that's a territory that we all want to occupy. My comment at last year's conference about HR coming of age was prescient. HR has come of age this year at a time and in circumstances we could never have appreciated or foreseen. You have shown how, despite a lack of nationally led workforce planning, you have redeployed tens of thousands of people to support the pandemic. All those years of partnership working with trade unions and building trust have paid off. You've shown that you know what counts rather than what demonstrates a return on investment, as you have invested in health and well-being of staff. Knowing that you can't demonstrate an ROI, but knew that it would make a difference to morale and to motivation at this time and to improve resilience, and frankly, because you knew it was just the right thing to do. And finally, you've demonstrated that care and compassion and supporting and serving those delivering hands-on care are more important than rigorously following policies and procedures. HR is now a strategic function, changing the outcome for patients, not a transactional function wedded to religiously following rules and procedures, but a function that knows its worth and knows how to make a difference. You really have been true architects of change. We do have a strong and a powerful collective voice, and I know that we can use it sensibly and constructively to bring about change that we all want to see. And we at the HPMA will be using that voice to encourage regulators to look at the impact of what we do to judges and not to be fixated on how up-to-date transactional processes and procedures are. And I'm optimistic. Not only have you led organisations during a pandemic, but you've also coped with enormous additional responsibilities during this time. The staff survey, the flu campaign, giving us the highest ever levels of uptake, lateral flow testing, risk assessments, and now preparing for COVID vaccinations on an enormous scale. I think we can all agree that 2020 has certainly been character building. Those working and delivering hands-on patient care, doctors, nurses, and AHPs have rightly been continuously thanked and clapped and appreciated. but I want to take this opportunity to unapologetically and unequivocally thank you, those working in the people profession. Thank you for your hard work and dedication on behalf of staff and patients. Thank you for your professionalism and your can-do approach in the middle of a pandemic when it would have been easy to see this fight as a clinical issue and to take a back seat. And thank you too for your sacrifice. The people that work in HR are not atypical of the population. We have friends and families, our carers and our parents, sons and daughters. We have the same hopes, joys, trials, tribulations, and the same challenges and heartbreaks as the rest of the population. I know that 2020 has been an extraordinary year. Many of you will have experienced times of joy and happiness and elation and self-worth. But I also know for many of you that this year you have lost friends and family, had heartbreak and upset, have fought your own personal worries, stresses and anxieties, and have felt the pain just as deeply and emotionally as others. And I know that it's been hard when we haven't always had the personal contact from those around us to hug us and to support us, to encourage us and to love us. Thank you. Thank you so much. You really are appreciated more than you know. And I am optimistic for the future. Firstly, there's only 30 days left in 2020. That's got to be worth looking forward to. And secondly, I believe that we have a responsibility to bring hope into our organisations, the hope that a new vaccine and improved testing can bring. And I know that you as a community will be at the forefront of moving forward with hope. You are by nature hopeful and optimistic. And I also hope that I can live up to what you want from the HPMA in 2021. I promise I'll be doing my best to promote the fantastic, high-skilled, caring and compassionate work you do every single day. Have a fantastic conference and enjoy the show. Thank you very much.
Thank you, Dean. As always, a very thought-provoking. I use the word activist. That's not from your bio, that's just from my experience of listening and talking to you over the years. So really, really excellent welcome address and lots of stuff in there I think that I could relate to. Yeah, and 30 days left in the year. That's fantastic, isn't it? And a vaccine on its way. So yeah, fingers crossed for a better 2021. But I do think, as you said, we've really risen to the challenge this year as a community, and we're in a great place. So thank you for that.